All India Radio presents Morning News. Good morning, I'm Sunil Varma and with me is Vaibhav Jyotsna Srivastav. The headlines: Health Minister Dr. Harshvardhan says India is in a much better place than the rest of the world in COVID-19 containment. Cautions against complacency. High-level multidisciplinary central teams deployed in 15 most affected states and union territories to contain COVID-19. Prime Minister Narendra Modi holds telephonic conversation with President of Philippines, Rodrigo Duterte, on steps to tackle COVID-19 pandemic and strengthen bilateral ties. Railways transported approximately 60 lakh migrant workers to their destination states since 1st of May. Union Minister Dr. Jitendra Singh says that private sector will be allowed to use ISRO facilities to improve their capacities. International Cricket Council approves replacements in Test cricket and bans the use of saliva to shine the ball in the wake of COVID-19. The 16th meeting of Group of Ministers, GOM, was held in New Delhi yesterday to review the containment measures of COVID-19. During the meeting, the GOM was briefed about the latest status, response and management of coronavirus in the country. GOM Chairman Dr. Harshvardhan said India is in a much better place than the rest of the world in dealing with the coronavirus pandemic. It was informed to the GOM that the COVID-related health infrastructure has been strengthened with the availability of 958 dedicated COVID hospitals with over 1.67 lakh isolation beds, over 21,000 ICU beds and over 73,000 oxygen-supported beds. Besides, 2,313 dedicated COVID health centers and 7,525 COVID care centers are now available in the country. It was also informed that ICMR's testing capacity has increased through 553 government and 231 private laboratories, and more than 49 lakh cumulative tests have been conducted in the country so far. In the last 24 hours, 1,41,682 samples were tested. It was also apprised that a total of 1,29,214 people have been cured, out of which 4,785 patients were cured in the last 24 hours. With this, the total recovery rate reached is 48.47% in the country. The total number of active cases now stood at 1,29,917. External Affairs Minister S. Jaishankar, Civil Aviation Minister Hardeep Singh Puri and Minister of State for Home Nityanand Rai and others attended the meeting. Here's a report.
During the meeting, a brief snapshot was presented to the GOM highlighting the comparative position of India with respect to other countries in similar stages of easing lockdown, underscoring the benefit that have accrued from the lockdown. The GOM was also briefed on the progress made in directions of the tasks assigned to the 11 empowered groups. Union Health Minister Dr. Harshvardhan said that India has entered into the Unlock 1.0 phase where restrictions have been eased and now people are required to be more disciplined. He strongly retreated that there is no space for complacency. He also urged everyone to download Arogya Setu app, which will help in self-risk assessment and in protection against COVID-19. In the meeting, Chairman of Empowered Group 5 presented the strategies adopted to ease the burden of lockdown while enabling supply of critical items for the country to fight the pandemic. With Anand Bhupendra Singh, AIR News, Delhi.
The Union government has deployed high-level multidisciplinary central teams in the most affected 15 states and union territories that are witnessing high numbers of COVID-19 infections. These teams shall assist the states and union territories governments by providing technical support for containment of COVID-19 pandemic in the country. The central teams have been deployed in Maharashtra, Telangana, Tamil Nadu, Rajasthan, Assam, Haryana, Gujarat, Karnataka, Uttarakhand, Madhya Pradesh, West Bengal, Delhi, Bihar, Uttar Pradesh and Odisha. The three-member team consists of two public health experts, epidemiologists, clinicians and a senior joint secretary level nodal officer. These teams are providing support to the state health department in implementation of containment measures and efficient treatment, clinical management of cases within the districts and cities. The central teams are providing assistance to resolve challenges like testing bottlenecks, low tests per million population, high confirmation rates, risk of capacity shortfall over the next 2 months, potential bed shortage, growing case fatality rate, high doubling rate and sudden spike in active cases. Many districts and municipalities have already formalized a dedicated core team at the district level to coordinate with the central team.
Amid rising cases of COVID-19 in Bihar, 4 central teams have been deployed to provide technical support for containment and to facilitate management of the outbreak. The teams have been deployed in 4 districts of Katihar, Darbhanga, Aurangabad and Madhepura. Meanwhile, the number of positive cases of coronavirus infection have mounted to 5,455. The total number of recovered patients are 2,770 and 2,651 patients are undergoing treatment in various hospitals. Death toll due to coronavirus is 33. In Gujarat, 470 new cases were reported in the last 24 hours, taking the number of cases in the state to 21,044. The Health Department said 331 of the fresh cases were reported from Ahmedabad district. The death toll in the state rose to 1,313, with 33 COVID-19 patients dying yesterday. On the other hand, 409 patients were discharged from hospitals, raising the number of recovered patients to 14,373. Our correspondent reports that there are now 5,358 active cases in the state, of which 64 patients are on ventilators. Meanwhile, Ahmedabad-based renowned critical care specialist Dr. Raj Raval has started a COVID home care service for patients with mild symptoms. A report from our correspondent.
While the continuous surge in the number of COVID-19 patients is adding excessive burden on the health system in Ahmedabad, renowned critical care specialist Dr. Raj Raval has formed a group of expert doctors and started COVID home care service for the patients with mild symptoms. Under this home care service, the patients are provided with assistant nurse, oxygen and monitoring in cases if it is required. Dr. Raval said, currently more than 50% of the cases fall in the category of mildly symptomatic patients with only fever and cough and whose oxygen requirement is also less than 5 liters. Those patients are treated under this service. He said, since the patients get treatment at home, their mental well-being is also maintained. The service has proven beneficial for all those who don't wish to get admitted in the hospital due to fear of coronavirus. Aparna Khund, AR News, Ahmedabad.
With the addition of 2,259 new cases, Maharashtra's COVID-19 tally has surged to 9,787. According to the State Health Department, the state has reported 120 deaths, with the toll now standing at 3,289. The number of patients who have recovered stands at 42,638, with 1,663 discharges in the last 24 hours. Mumbai, on the other hand, recorded 1,015 new cases, with the total rising to 50,878. The city recorded 58 deaths, leading to a toll of 1,758. Meanwhile, a notification issued by Municipal Commissioner I.S. Chahal provides some additional relaxations for shops and markets. More from our Mumbai correspondent.
Even as the city continues to witness a rise of more than 1,000 new cases daily, Mumbai civic body has allowed shops and markets to remain open for full working hours. A notification in this regard clarifies that all market complexes, shopping malls, garden or play area equipments, swings and bars and open-air gyms will remain closed. The order states that shops and markets can operate on an odd-even basis on weekdays, adding that all will remain shut on Sunday. It states that private offices with 10% staff, educational institutes with non-teaching staff can also operate for full working hours. The new relaxations coming into effect immediately will not be applicable for containment zones. The civic body has further said that the curfew announced between 9 p.m. to 5 a.m. by the state government will have to be followed. Meantime, Maharashtra government informed the Bombay High Court that COVID-19 infected inmates are getting cured in the Arthur Road Correctional Home due to unceasing efforts of the Prison Department and Medical Authority. Madhuri Pange, AIR News, Mumbai.
The Tamil Nadu government has cancelled public examinations for the 10th standard this year due to the looming COVID-19 situation. In an order, the government has said all the students are deemed to have passed the examinations. The marks of the students will be assessed with 80% weightage for the average score obtained in the quarterly and half-yearly examinations and 20% for school attendance. Over 9.7 lakh students were earlier scheduled to appear for the examinations from the 15th of this month. The state government's decision comes in the wake of the Madras High Court suggesting postponing the tests in view of the COVID-19 threat. There has also been a growing chorus by most of the political parties, including the allies of the ruling AIADMK and a section of the parents and teachers, to either defer or do away with the tests this year. Along with the 10th standard, the board exam for the last paper left for the 11th standard has also been abandoned. Meanwhile, in Tamil Nadu, the total number of COVID-19 infected cases has gone up to 34,914, with 1,685 people tested positive in the last 24 hours. The new cases included 1,243 in Chennai. 798 people were discharged from hospitals after recovery. 21 patients succumbed to the viral disease, taking the toll to 307. More from our correspondent.
As Chennai continues to add up more and more COVID-19 cases, the State Health Department is scaling up the number of beds for treating the patients carrying the viral load. 3 different medical centers are expected to add 1,100 beds more exclusively for COVID-19 admission in the city, as said by the State Health Minister Dr. C. Vijayabhaskar. They include 300 beds each in the Chennai Fortress Old Hospital, the old premise of the Institute of Ophthalmology at Egmore, and 500 in the National Center for Aging, a center of excellence established inside the King Institute of Preventive Medicine and Research at Guindy with the Union Government assistance. Mr. Vijayabhaskar said the Guindy facility will mostly accommodate geriatric or aged patients with comorbidity conditions. Besides, several private medical college hospitals and 88 private hospitals have also come forward to allot beds exclusively for COVID-19 treatment in Chennai by following the state-run health insurance package. Jai Singh, AER News, Chennai.
In West Bengal, another 372 people were tested corona positive in the last 24 hours in the state. With this, the total number of corona-infected persons has risen to 8,985. 10 persons died of the disease during the period, taking the total number of death toll to 415. More from our Kolkata correspondent.
A 3-member central team currently on visit to West Bengal as corona infections are in spate in the state. The team, headed by the Joint Secretary of the Home Ministry Piyush Goyal, had a meeting with the state administration on COVID situation. They also visited a quarantine at Rajarhat. The number of COVID cases are highest in Kolkata, followed by North 24 Parganas and Howrah district. Out of 23 districts of the state, most of the districts are under containment zone. The central team will give technical support and facilitate management of COVID-19 outbreak to state as well as municipalities. Meanwhile, the state government has modified its guidelines on attendance at offices by its employees. The state government has launched a web portal named as Karmabhumi for IT professionals and others who have returned to West Bengal and looking for job due to COVID-19. Arijit Chakraborty, AIR News, Kolkata.
Tripura registered its first COVID-19 related death in the state after a 42-year-old male patient expired yesterday. At present, the state has a total of 867 COVID-19 positive patients with 670 active cases, while 192 have recovered so far. The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. You can also ask questions on the telephone number 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by the hashtag AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:30 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on Air Official. You can also follow us on the News on Air app for updates.
In our series, Experts Speak on All India Radio, we bring you views of leading medical experts on COVID-19. Talking to AIR News, Dr. Uma Kumar, head of Rheumatology Department AIMS, said that till date there is no proven medical treatment for coronavirus infection.
Only thing which helps is social distancing or physical distancing. Along with it, you have like hand hygiene, washing your hands very frequently, and cough etiquettes like while coughing or sneezing, just cover your face and nose. Use tissue paper or cloth, or if you don't have anything, you can just cough into your elbows. So third thing is using the face mask. For a general public, you can use cotton face mask, and then they have to be very positive. Don't give up, and surely we'll conquer over this virus.
President of Public Health Foundation of India, Dr. K. Srinath Reddy, said India is in a much better position as compared to the rest of the world as far as COVID-19 cases are concerned, and the measures taken are yielding results.
We started getting affected later than many other countries, but we are presently in a much better position than the rest of the world, and in that sense, we are better protected. However, we still have to watch how the epidemic advances over the next 2 to 4 weeks before we can come to a judgment. But right now, it appears that our measures taken progressively from February and peaking with the lockdown are now paying dividends and showing results.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Health Minister Dr. Harshvardhan says India is in a much better place than the rest of the world in COVID-19 containment, cautions against complacency. High-level multidisciplinary central teams deployed in 15 of the most affected states and union territories to contain the COVID-19 infection. Prime Minister Narendra Modi holds telephonic conversation with the President of Philippines, Rodrigo Duterte, on steps to tackle COVID-19 pandemic and strengthen bilateral ties. Railways transports approximately 60 lakh migrant workers to their destination states since the 1st of May. Union Minister Dr. Jitendra Singh says that private sector will be allowed to use ISRO facilities to improve their capacities. An International Cricket Council ICC approves replacements in Test cricket and bans the use of saliva to shine the ball in the wake of COVID-19. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
अपने साथ अपनों का ध्यान रखो, बड़े बुजुर्गों का तुम ध्यान रखो, तो बात करो, कुछ मदद करो, कोरोना के चलते याद रखो, घर से निकलो तो मास्क पहनना, मास्क के पीछे मुस्कुराना, सुरक्षित दादा दादी नाना नानी अभियान, अपने साथ अपनों का ध्यान.
Prime Minister Narendra Modi had a telephonic conversation with the President of the Philippines, Rodrigo Duterte, yesterday. The two leaders discussed steps being taken by the two governments to address the challenges arising out of the COVID-19 pandemic. Both the leaders appreciated the efforts made to ensure the welfare of their citizens in each other's territory during the ongoing health crisis. The Philippines President also appreciated the steps taken by India to maintain supply of essential pharmaceutical products to their country in this difficult time. Prime Minister Narendra Modi assured of India's commitment to support the Philippines in their fight against the pandemic and stressed that India's well-established capacity for manufacturing affordable pharmaceutical products would continue to be deployed for the benefit of the entire humanity. Mr. Modi and Mr. Duterte expressed their satisfaction at the progress made in recent years in strengthening the bilateral relationship, including defense cooperation. The Prime Minister emphasized that India sees the Philippines as a vital partner in the Indo-Pacific region. He also conveyed his best wishes to Mr. Duterte and the people of the Philippines for the forthcoming National Day of the Philippines. Indian Railways will continue to provide Shramik special trains within 24 hours after the demand is received from the states. The Railway Ministry has requested the state governments to indicate their requirements about Shramik special trains. Railway Board Chairman Vinod Kumar Yadav said that Indian Railways will provide the desired number of Shramik special trains within 24 hours of the request made by the state governments. Railways has also assured that it will provide additional Shramik special trains for any future requirement. More than 4,347 Shramik special trains have been operated by railways to transport approximately 60 lakh migrant workers to their destination states since 1st of May.
Sale of tickets for the third phase of Vande Bharat mission Air India flights from destinations in Europe to India will commence from this afternoon at 3:30 p.m. Indian Standard Time. The tickets can be booked from Air India website only. The national carrier has asked applicants to ensure that they are registered with the local Indian embassy or the High Commission, as it is a prerequisite to board flights under the Vande Bharat mission. Last week, more than 22,000 tickets were sold within a short span of 15 hours when flight bookings commenced for destinations from US, Canada and other countries. In its largest repatriation mission across the world, India has already brought back over 70,000 nationals. Under the third phase of the Vande Bharat mission, starting from today, Air India will operate around 300 flights to Europe, Australia, Canada, US, UK and Africa. In Madhya Pradesh, a Kuwait Airways Corporation KAC's special flight carrying 51 Indians who were stranded in Kuwait amid the COVID-19 outbreak landed at Indore last night. Airport officials informed that KAC aircraft landed in Indore after taking a halt at Delhi where some passengers disembarked. Health checkup of all the passengers was conducted and their belongings were sanitized. Chief Medical and Health Officer of the district, MP Sharma, said that all of 51 passengers were sent to quarantine centres where they would be kept for 7 days and will also be tested for COVID-19.
Road Transport and Highways Minister Nitin Gadkari has announced further extension of the validity date of motor vehicle documents till September this year due to COVID-19 situation in the country. The ministry has issued an advisory to all states and union territories in this regard. State and union territories have also been requested to consider provisions available under the Motor Vehicle Act 1988 for considering relaxation in requirement of permits, fees and taxes for renewal to provide relief in the present situation. The Minister of State for Atomic Energy and Space, Dr. Jitendra Singh, has said that private sector will be allowed to use Indian Space Research Organisation ISRO facilities and other relevant assets to improve their capacities. He was speaking about the country's achievement in the field of space technology during the first year of the second term of the Narendra Modi government. Dr. Singh said the Modi government's Atmanirbhar Bharat roadmap towards self-reliant India envisages the initiative to boost private participation in space activities. He said Indian private sector will be a co-traveller in India's space sector journey. He added that private companies will be provided level playing field in satellites and space-based services. He said future projects for planetary exploration will be open for private sector. On India's first ever human space mission, Gaganyaan, to be undertaken by ISRO, Dr. Singh said the selection of the astronauts was accomplished and their training in Russia had also started but got interrupted because of the coronavirus pandemic. He said the project would be followed up soon. He said during the first year, ISRO launched a special program for young school children called Young Scientists Program, Yuvika. The program is primarily aimed at imparting basic knowledge on space technology and its applications to the younger generations.
The government is contemplating the option of reduction in the syllabus and instructional hours for the coming academic year. Human Resources Development Minister Ramesh Pokhriyal Nishank has said that the government has received a lot of requests from parents and teachers in view of the current circumstances due to the pandemic. In a tweet, Mr. Nishank appealed to all teachers, academicians and educationists to share their point of view on the matter using the hashtag Syllabus for Students 2020 on either his or the Ministry of Human Resources Development's Twitter and Facebook page so that they can take them into consideration while making a decision. In the Union Territory of Jammu and Kashmir, an encounter has broken out between terrorists and security forces in Sugo area of South Kashmir's Shopian district in the wee hours today. Shopian Police, 44RR and CRPF have launched a cordon and search operation CASO in Sugo village after getting a specific input about the presence of terrorists in the area. This is the third encounter in Shopian that has erupted between the security forces and the terrorists in this week. Further details are awaited.
The Employees Provident Fund Organization, EPFO, has settled 36.02 lakh claims and disbursed 11,540 crore rupees to its members during the lockdown in the last 2 months. A Labour Ministry statement said, to enhance the ease of living experience of its members during the challenging times of COVID-19 lockdown, EPFO has left no stone unturned in ensuring timely and effective delivery of services to its members. Respecting the social distancing norms at workplace, EPFO worked with less than 50% staff during the lockdown. Notwithstanding the shortage of manpower, EPFO significantly brought down the claim settlement period from around 10 days to roughly 3 days for COVID-19 advances. Our correspondent reports, with automation and dedicated workforce, EPFO is settling more than 80,000 claims every working day, amounting to about 270 crore rupees, ensuring social security support for its members in times of crisis.
International Cricket Council ICC on Tuesday has approved substitution in case a player shows symptoms of COVID-19 during a test match, besides ratifying the interim ban on using saliva to shine the ball. The ICC has also reintroduced non-neutral umpires for bilateral series as part of its interim playing regulations to tackle the threat posed by the COVID-19 pandemic. In the 5 new regulations recommended by the Anil Kumble-chaired Cricket Committee and ratified by the Chief Executives Committee CEC, the teams will also be allowed an additional DRS call, as home umpires will now be officiating in bilateral test series. The ICC in a press release said that a 32-inch additional logo would also be permitted on the players' jerseys for boards to make up for financial losses due to the pandemic. However, the regulation for COVID-19 replacements will not be applicable in ODIs and T20 internationals, it added.
Now, let's take a look at weather forecast for today. The national capital Delhi will have generally cloudy sky with light rain or drizzle. Minimum temperature recorded was 28 and maximum is expected to be 40 degrees Celsius. Mumbai will have generally cloudy sky with a few spells of rain or thunder showers. Minimum temperature recorded was 24 degrees Celsius, maximum around 34 degrees Celsius. Tamil Nadu capital Chennai will see generally cloudy sky with light rain. The minimum temperature recorded was 30 degrees Celsius and maximum is expected to go up to 37 degrees centigrade.
Ahmedabad's forecast says generally cloudy sky with light rain. The minimum temperature was 25 degrees Celsius while the maximum will be around 37 degrees Celsius. Guwahati is likely to witness rain or thunder showers towards the afternoon or evening. In the Union Territory of Jammu and Kashmir, the minimum temperature would be 25 degrees Celsius in Jammu, while the maximum will be around 37 degrees Celsius. And now an overview of today's newspapers. Most dailies lead with reports of the increase in COVID-19 cases in Delhi. Delhi could reach 5.5 lakh cases, need 80,000 beds by July end, says Sisodia, reads the headline of the top story in the Times of India. After its order on beds junked, Delhi project spiked to 5.5 lakh by July, writes the Indian Express. India's daily spike inching towards the 10,000 mark, headlines the statement. Hindustan Times quotes WHO chief's warning that the pandemic is worsening. India-China disengagement at the LAC is prominently reported in the dailies. Slight pullback by China, India in Galwan area is the headline in the Asian Age. And finally, many dailies, including The Hindu, carry photographs of the Oil India Limited well that has caught fire. The accidental fire happened 13 days after the well started spewing gas, writes the paper.
And now, before we end the bulletin, the headlines once again. Health Minister Dr. Harshvardhan says India is in a much better place than the rest of the world in COVID-19 containment, cautions against complacency. High-level multidisciplinary central teams deployed in 15 most affected states and union territories to contain COVID-19. Prime Minister Narendra Modi holds telephonic conversation with President of Philippines, Rodrigo Duterte, on steps to tackle COVID-19 pandemic and strengthen bilateral ties. Railways transports approximately 60 lakh migrant workers to their destination states since 1st of May. Union Minister Dr. Jitendra Singh says that private sector will be allowed to use ISRO facilities to improve their capacities, and International Cricket Council approves replacements in Test cricket and bans the use of saliva to shine the ball in the wake of COVID-19. With that, we end the morning news. Have a nice day.